The Edo State government has assured residents to stay calm over the diphtheria disease, noting that measures have been put in place to curb the bacterial disease. The Commissioner for Health, Dr. Cyril Adams Oshiomhole, on Friday disclosed this while fielding questions from journalists about the state government's efforts to combat the disease. BTV News' Osarogi Agwebo reports that the Commissioner for Health, while assuring of government's proactive measures, also advised residents to maintain good sanitation and hygiene.
Diphtheria is a highly infectious disease that causes serious health complications, particularly in children. The national outbreak of this seasonal disease brought fear and anxiety among citizens, especially residents in Edo State, due to the misinformation that the outbreak is limited to the state. Commenting on this, the Commissioner for Health, Dr. Cyril Adams Oshiomhole, said there is no cause for alarm as the state government has put in place measures to prevent and control the disease to ensure the well-being of citizens. He said with the support of Governor Okpebholo, they have provided necessary medications and essential equipment for patients, adding that they are set to carry out vaccinations for children across the state to help protect them against the disease.
For our support, immediately we swung into action. I personally contacted the General of Nigeria Center for Disease Control, who was able to mobilize 70 doses of diphtheria antitoxin, and also IV azithromycin, because currently IV azithromycin is not available in the country, so they had to use alternative drug. We also went to Delta State to get 20 doses of DAT, diphtheria antitoxin. Everything was mobilized to the University of Benin Teaching Hospital. That means that there could be risk of transmission within the hospital. So they opened the isolation ward and went there. It was almost empty. Within 48 hours, 2 days later, I went there. We donated 10 beds, hospital beds, mattresses, 5 oxygen cylinders, IV fluid, personal protective equipment, shoes, uniforms, detergent, and so many other stuff. 27 items in general. And that shows proactiveness of our government, because they have been giving us the support. So we got the Ministry of Health working in connection with the Ministry of Environment and as well the Ministry of Education. I spoke with the Commissioner of Education to give us the go ahead to vaccinate children from 5 to 14, because we discovered some teenagers are also coming down with diphtheria. So what we are doing is reactive vaccination, as giving booster dose to this set of children.
Dr. Cyril Adams Oshiomhole advised residents to maintain good environmental sanitation and personal hygiene, and to swiftly seek medical attention if they notice any symptoms of diphtheria to avoid complications.
Environmental sanitation is very, very key, and I commend the government for introducing the monthly environmental sanitation, because for you to be able to control vector, which is the mosquito here, we have to look at stagnant water, refuge, we keep our refuge. So also before now, we have been fighting Lassa fever as well. And we know Lassa fever has to do with the transmission. The vector is rats. And of course, the environment, also we keep other the environment. The environment is not clean, so rats will breed, waste bin, refuge, close to the house. So emphasis should be on the environment at this time.
The Commissioner for Health urged residents to stay calm and focus on improving their personal hygiene rather giving in to anxiety. Osarogi Agwebo reporting for BTV News.